Every year, thousands of elderly Asian immigrants arrive in the United States well past retirement age. They have never worked a single day on American soil. They have never paid a dollar into the Social Security system. And yet, within a few years of landing, many of them begin receiving monthly government checks, free healthcare, and food assistance funded entirely by American taxpayers. This is not a glitch. It is not fraud. It is a legal pathway built into the United States immigration system that most Americans have no idea even exists. And once you understand how it works, you will never look at immigration the same way again. Here is the setup. An American citizen, usually someone who immigrated years ago and eventually naturalized, petitions to bring their elderly parent from Asia to the United States through family-based immigration. This is one of the most common pathways for legal immigration. The adult child files an immigrant visa petition and signs a legal contract called an affidavit of support, promising the federal government that they will financially maintain their parent at 125% of the federal poverty level. On paper, this means the American taxpayer should never have to foot the bill. The sponsor is supposed to cover everything. But what happens in practice tells a very different story. Once the elderly parent arrives in the United States and receives their green card, they become what is known as a lawful permanent resident. Now, under normal circumstances, a green card holder who entered the country after August of 1996 must wait at least 5 years and accumulate 40 qualifying quarters of work, roughly 10 years of employment, before they can access Supplemental Security Income, commonly known as SSI. For a 65-year-old who just arrived in the country, working 10 years sounds like a tall order. But here is where the system gets interesting. The 40 quarters do not have to come from the immigrant's own work history. Under federal law, a spouse's or a parent's qualifying work quarters can be credited to the immigrant. So, if the elderly parent's adult child, the one who sponsored them, has been working and paying into Social Security for 10 or more years, those work credits can be applied to the parent's eligibility. The parent themselves may have never held a job in America, but through their child's employment record, they can meet the threshold. Once those 40 quarters are satisfied and the 5-year residency requirement is met, the elderly immigrant becomes eligible for SSI. As of 2026, the maximum federal SSI payment is $994 per month for an individual. In states like California, a state supplement pushes that figure even higher to roughly $1,183 per month. That is nearly $12,000 a year in cash benefits for someone who has never contributed to the system. And SSI is just the beginning. In most states, anyone who qualifies for SSI is automatically enrolled in Medicaid, the government health care program for low-income individuals. This means the elderly immigrant now receives free medical coverage, including doctor visits, hospital stays, prescription medications, lab work, and in many cases, dental and vision care. In California alone, where a massive concentration of Asian immigrants reside, Medi-Cal provides comprehensive coverage with virtually zero out-of-pocket costs for SSI recipients. But what about the affidavit of support, the legal contract their child signed promising to financially support them? This is where the system reveals its most controversial gap. While the law technically requires the sponsor's income and resources to be counted when determining the immigrant's eligibility for means-tested benefits, a process known as sponsor deeming, the enforcement of this rule has been described by federal officials as extremely rare. According to a Congressional Research Service report, officials from all 10 Social Security Administration regional offices reported that sponsor deeming has occurred either rarely or never since the welfare reform law took effect. The reason is a legal catch. Sponsor deeming does not apply to immigrants who have already been credited with 40 quarters of work. Since most sponsored immigrants only become eligible for SSI after meeting that 40-quarter requirement through a family member's work history, the deeming provision essentially becomes irrelevant by the time they qualify. And it does not stop at SSI and Medicaid. Elderly immigrants who meet the income requirements can also access the Supplemental Nutrition Assistance Program, or SNAP, which provides monthly funds for groceries. Some qualify for subsidized senior housing through programs like Section 8. Others receive in-home supportive services, a California program that actually pays a family member, often the same adult child who sponsored them, to serve as a caregiver. So the child brings the parent to America, the parent qualifies for government benefits, and then the child gets paid by the state to take care of them. It is a closed loop of public funding that, while entirely legal, strikes many Americans as a system designed to be exploited. Now here is where we need to be honest about who is actually using this pathway. While this system is available to immigrants from any country, the data shows that Asian immigrants make up a disproportionate share of elderly non-citizens receiving SSI. Over 3/4 of all non-citizens on SSI are aged 65 or older, and a significant number are from countries like China, Vietnam, Korea, India, and the Philippines. This is not because Asian families are doing anything wrong. It is because Asian immigration to the United States has historically been driven by family reunification, and the family-based visa system is the primary mechanism that brings elderly parents into the country. Critics of this system argue that it was never intended to function as a retirement plan for people who spend their working lives overseas. They point out that the average American worker pays into Social Security for decades before seeing a single dollar in return, while an immigrant who arrives at 65 can begin collecting benefits within a few years through a family member's work credits. The frustration is compounded by the fact that SSI was originally designed as a safety net for America's most vulnerable citizens, the elderly, blind, and disabled, who had no other means of support. Defenders of the system counter with an important point. These elderly immigrants are not arriving illegally. They are sponsored through a legal process that requires their children to demonstrate sufficient income. Many of them play vital roles in their families, providing childcare, cooking, and household support that allows their adult children to work and contribute to the economy. Without them, many working-age immigrants would need to pay for daycare or reduce their working hours, potentially costing the economy more than the benefits their parents receive. There is also the human side of this story that the outrage often ignores. Many of these elderly immigrants arrive in a country where they do not speak the language. They are isolated. They are dependent on their children for everything. The monthly SSI check they receive is not luxury money. It is survival money in a country where the cost of living can be staggering. $994 a month does not go far when rent in most American cities exceeds $1,000. These are not people living lavishly on the government's dime. They are elderly men and women navigating the final chapter of their lives in a foreign land. But the political reality is shifting. In 1996, Congress passed the Personal Responsibility and Work Opportunity Reconciliation Act, which was specifically designed to restrict immigrant access to welfare programs. That law created the 5-year waiting period and the 40-quarter work requirement. And yet, as we have seen, loopholes in the system have allowed many of those restrictions to be circumvented. More recently, the 2025 Budget Reconciliation Bill has proposed even tighter restrictions on immigrant access to Medicaid, potentially cutting off coverage for refugees, asylees, and humanitarian parolees starting in October of 2026. The political winds are clearly blowing toward stricter enforcement. The question that remains is not whether this system is legal. It clearly is. The question is whether it is fair. Is it fair to ask American taxpayers to fund retirement benefits for people who never contributed to the system? Is it fair to deny elderly parents the chance to live with their families in America simply because they are old? Is it fair that a country built by immigrants now debates whether those immigrants deserve to grow old here with dignity? There are no easy answers. But one thing is certain. This is not a conversation most Americans are even aware is happening. And as the population of elderly immigrants continues to grow, and as government benefit programs face mounting financial pressure, this quiet corner of the immigration debate is about to get very loud.